Hi, Eric Esshaki here. Right now, our response to coronavirus is devastating our economy. Economists are predicting that our economy will shrink by 13% by the time this is over if we don't act quickly. So we need a plan to turn things around, and we need that plan now. Plan must consist of and include a robust quarantine for our at-risk population. Once we've achieved that, we have to work to reopen our economy as quickly as possible. Now, as a former nurse and healthcare professional for nearly 10 years, I spent a lot of time working with our elderly population. I recognize the seriousness of our current situation. Our leaders at the state and federal level reacted as best they could. They deserve credit. Hopefully, their actions will have slowed the spread of this virus and bought us some time. But we must use that time wisely. This isn't going away in 15 days. We can slow the spread of the virus and pay people's bills for the next few weeks, but those are just temporary fixes. What happens to our economy? What happens if the experts are right and this thing goes on for 2 months or 3 months or longer? This is not sustainable. Our current reaction is not focused enough because we've targeted everyone when we know that about 15% of our population faces the more serious risk from this virus. We're not focusing sufficiently on those who are most vulnerable. So here's what we need to do. Number one, our at-risk population must be quarantined. Number two, we have to implement and mobilize delivery and care services for that population. We have to make it easy for them to safely stay in their homes for the next 60 to 90 days. Number three, we have to protect our healthcare workers. They're going to suffer more than many realize because they'll largely be part of that isolated population. Number four, we have to designate specific treatment centers for coronavirus. This will aggressively limit the transmission of the virus into the healthy population. We'll also need to shift medical resources there to these facilities as well. Number five, we have to immediately impose strict no visitation policies for our hospitals, our nursing homes, and our assisted living centers. This will include strict safety protocol for the workers there as well. At the end of these next few weeks, once these measures are instituted, we've got to reopen our economy. If we don't, we face economic catastrophe that will cause tens of millions of Americans to suffer more than they already have. Now, the current plan or lack thereof assumes that this is all going to magically get better. It won't. We need to act now. As Americans, we've always risen to the occasion, and I know we'll rise to this occasion, but it'll require some sacrifice and the courage to act boldly. I'll continue to provide updates on a daily basis, and I ask that you follow me on Facebook and Twitter. In the meantime, stay healthy, everyone, and God bless you and your family. Thank you for listening.